Welcome, and thank you for joining Chamberlain University's Mastermind Discussion Session. I'm Christy Marino. I'm a Senior Workforce Solutions Consultant for Chamberlain University, and it's my honor and privilege to moderate today's topic, Reestablishing Trust in Healthcare During a Pandemic. Today I have joining me my distinguished panel, Dr. Janina Johnson. Dr. Johnson is the director of the BSN online program here at Chamberlain University. She's been a nurse since 1999 and has a combined 20 years experience in clinical practice and nursing education. She has served in the roles of faculty and academic leadership, developing and delivering campus-based and online undergraduate and graduate programs in nursing. Dr. Johnson is an experienced speaker both nationally and abroad, presenting on a variety of topics including clinical supervision, program evaluation, and trauma-informed care. Welcome, Dr. Johnson.
Hi, Christy. Thank you. Thank you for the introduction. And thank you for allowing me to join this wonderful group of panelists to discuss an important topic for us today, and that's healthcare and education in the wake of a pandemic and all that means to us as we move forward. So thank you.
Absolutely. Thank you for joining us. And my next panelist I'm proud to present is Dr. Melissa Harker. Dr. Harker is the Network Director of Nursing Education at Hackensack Meridian Health, whose professional practice as an educator has centered on the education of nursing students, new graduates, new team members, and preceptors. She's also served as Education and Training Manager of Integrative Health and Medicine and is also an adjunct faculty member at several academic institutions. Her doctoral practicum addressed the healthcare needs of vulnerable populations, specifically the healthcare needs of LGBTQ patients. Welcome, Dr. Harker.
Thank you, Christy. It's an honor to be here and to be a part of this distinguished panel to talk about how we are going to impact patient trust as we move forward through this pandemic. Thank you.
Thank you. And last but not least, we have Kiana Green, who is our final panelist. Welcome, Kiana. Kiana is a healthcare development specialist on the Workforce Solutions team for Chamberlain University, and she works in Maryland, DC, and Delaware. She's a 19-year healthcare industry veteran and has managed an array of healthcare units and facilities, which include trauma, surgery, and post-anesthesia care. Kiana has built a solid foundation of corporate and clinical clients through her clinical consultant services. Her specific areas of expertise and certification include forensics, surgery, and medical cannabis. Welcome, Kiana.
Thanks for having me, Christy. And I'm delighted to be here, especially with the rest of the panel that's here to discuss the educational opportunities and also the communication that's happening right here amongst the COVID-19 and how we can better serve the communities.
Absolutely. It's a very timely topic, and I think has been an elephant in the room a lot for people. And I'm really, really proud that we have the opportunity to address this today professionally. And so let's get started with our discussion. Establishing patient care and patient trust has been often episodic due to the changing landscape of healthcare and global pandemic impact. So the psyche of the American healthcare patient, as well as the caregiver, has shifted. There's been a shift in trust, both at the macro and the micro levels. The patient experience and delivery of care has changed dramatically, and we've been catching up as we've been going and learning as we've been doing. So healthcare professionals are challenged with meeting the constantly changing needs of our population and the gaps in academic practice. So today we're going to discuss how healthcare educators can improve practice readiness and reimagine quality patient outcomes. So our first question to our panel is going to be, how do we encourage that trust in healthcare and healthcare education? What are some examples of what you're seeing in your day-to-day professional and personal experience that has indicated that there has been that episodic shift in trust? I'm going to start with Dr. Johnson.
Oh, thank you, Christy. So I'm going to answer this obviously from an academic setting point of view. And in education, in terms of the pandemic, I think it's very important for universities and educational institutions to be having open, timely, and consistent communication with both their faculty, colleagues, and students. This is very important for establishing trust. And it's important that this information that we're providing is continuous, and it's also based on science, facts, and the leading experts. As we know, there's a lot of information out there, and this is a time of high uncertainty, and misinformation can increase stress and worry among others, and then also the trust level that they might have. So I think it's important for universities, again, to be having that timely communication, to be surveying and discussing with both colleagues and students how they're feeling about this pandemic. And then also here at Chamberlain, having the opportunity of looking at how we're going to reopen in the face of the pandemic, and learning, again, taking a phasic approach based on safety and also comfort of our colleagues and our students. Just some examples and day-to-day of the life in the university for, I think, our students I'll talk about, is that we understand the uncertainty and the stress that can cause. And then also not knowing, am I going to finish my degree? How am I going to go to school? We have campuses and we have online programs. In our campuses, we've shifted drastically from the ground and onto an online platform in an amazing amount of speed, but also with the quality in what we've done with that, and have communicated with the students the entire time. So they didn't have much of a gap in their learning from going from campus to going online. And another thing that we've done too in our online programs, which are strong and mostly on the graduate side, we have working professionals, and we know that their workloads have changed due to the pandemic. We have nurses who's been called back to the bedside, working higher hours. So we know that having flexibility with assignments and the expectations for coursework and when that's going to be done is important, which we have implemented. And also some people might need to be taking a little break from school as well. And we've also implemented ways to support others so that they can work now and continue school.
It's a really great summation, Dr. Johnson. Thank you so much. And as I'd like to turn to Dr. Harker to speak more to the practice side of healthcare and some of the examples that you've been seeing in your day-to-day professional and personal experience that has indicated that there's been that episodic shift in trust. Dr. Harker.
Thank you, Christy. Yes, I think one of the things we were initially most concerned about was the fact that our patients would not be able to have visitors and that they would be separated from families, loved ones. And we really wanted to think about how best to make those connections for patients and for families so that we could still have that established trust and that patient and family-based care that is so important to us. So we knew we had a resource of nurses who were not bedside clinical nurses. They worked in our health information management department, our case management department. So they would not be working at the bedside in ICU or any of those areas, but we did feel that they would be a wonderful resource to come forward almost in redeployment to work on making those connections and making sure that the patients and families and the updates and all those phone calls that were coming in were not being answered by direct care providers who had lots to do, but they were answered by people who were able to answer the questions, give empathy, make those connections, and establish that trust between the organization and the patient and the caregiver. So for us, that redeployed team of about 546 people was just so valuable in really allaying a lot of the fears and the gap in communication. So we were really
Wow.
to them.
Yeah, talk about a real-time change and implementation at light speed too. That definitely sounds like you really had your work cut out for you there too, in making that all happen and putting all those pieces together. So I'm going to also just ask Kiana to hear what your perspective has been on this particular question.
Absolutely. I can follow up with both Dr. Harker and Dr. Johnson with the whole trust piece and establishing trust that's happening right now throughout our communities. Like I was stating when I talked with them earlier in regards to turning on your televisions, looking at CNN or Fox News or whatever it is that you watch. How there seems to be such a disconnect in regards to what our government leaders are wanting to do for our communities as opposed to what the healthcare professionals are recommending. And so, of course, it can be discouraging for many of our community members, many of our patients, our students, people just not understanding where the disconnect is coming from. And so, one of the things that we did here at Chamberlain in regards to at least having to encouraging our students or having a platform during this COVID season was to make sure that we could offer refresher courses, not just for our students, but actually for the nurses in the community. Refresher courses for students who were about to approach or take their NCLEX. We had NCLEX prep for them. And for those nurses, like Dr. Harker was talking about, working in other specialty areas that necessarily did not work in med surg or did not work in ICU, but were able to go back with Chamberlain offering these courses as refreshers because of the influx that we were receiving throughout the entire, throughout all of the states and all of the local hospitals of the need for nurses, especially as we all remember when that first started in New York, the influx and the lack of nurses that was happening there. So I felt like, with us being able to offer that, and for those nurses who were retired, were able to actually come out, and this was also offered for them too, to come back into the hospitals to help with that. So though, we're not necessarily able to cover that conversation right now of the disconnect that's happening between our leaders and healthcare professionals, we were able to at least provide some educational standpoints to that. My hope is for the future, just like, we're able to turn our televisions on and kind of get this information about the lackluster of COVID right now. My hope is that we can continue to educate our community about COVID, what it is, how it's transmitted, the importance of keeping it at the forefront so that we don't continue to have poor outcomes for patients.
So important. Absolutely, Kiana. Thank you so much. There were so many great examples in there. And it's so true. We really do see, from the mask debate to just all these different topics that are swirling around both between social media, the news, all these different things, face-to-face communication, and patient education and really just communication in general has gone into a different pattern. And so the current landscape of healthcare has changed due to that. People are anxious sometimes about going to see a doctor or visit a hospital, or they may be getting sick more because they're avoiding seeking that care. And when there's that lost trust, how do we rebuild that? So I'd like to just put that out there to you all as a panel. Dr. Johnson, would you like to discuss this? How do we rebuild?
Yeah, so thank you, Christy. I think you bring a valid point here. And I do, when we're looking at this situation as a whole and we're thinking about the pandemic and it's altered some of the perspectives on safety of our healthcare system and the ability to provide equitable care to admitted patients. We've heard lots of these examples of lack of PPE, of crisis triage and care due to scarcity of resources, such as ICU beds and ventilators. And so, yes, there is a growing mistrust of our healthcare system from the general population. But I also want us to take a moment and pause and think about this from a different lens as well. There is really a historic long-standing mistrust of healthcare providers, establishments, and education institutions from communities of color. And one thing that we've learned from this pandemic, we've learned a lot going into this, but among the lessons is the importance of health equity and decreasing disparities. And so when we look at trust on from a more widespread lens, we can see this as well. So as we're talking about trust today and what we can do to rebuild, understanding rebuilding is a long-term objective. It's not a short-term fix. But I think one of the things that we can do as an educational institution is to understand that we need to be educating and providing education to more minorities, so that we are increasing the concordance of our providers, our healthcare professionals, and the patient, which is going to in turn increase the trust that we have there in the healthcare setting. So Chamberlain is currently the leading grantor of BSN nursing degrees to underrepresented minority students in the US. This is one step in helping to increase diversity in nurses who care for the diverse population. And as I said, having graduating these nurses of color helps to increase that resemblance between the nurse and the patient, which is going to support initial trust between the patient and the provider. And this also decreases a lot of the stress that is associated with what we call racial anxiety. And that comes from not knowing, that comes from actually emotions that we have when we're interacting with people of other races. And so that congruency in racial makeup or ethnic makeup is going to help with increasing trust and establishing trust throughout healthcare. I know this is an initiative that was started before the pandemic, but again, the pandemic has just highlighted the importance for this in our healthcare settings.
Absolutely, absolutely. I think Dr. Harker can also speak to this as well.
Yes, I think, we're really at this point relying heavily on our communications and marketing team to really communicate to the public what it is that we are doing, what we have in place, what is making care safer, special resources that we have. Our whole telemedicine division really allows a patient who maybe is not very ill and has just minor symptoms to get on a telephone, a mobile phone, or an iPad or a computer, speak with a physician, get an assessment, get treatment without having to enter our acute care hospitals if that's not something that they're comfortable with. I think our community outreach, education, and population health nurses who really know their communities that they're assigned to have now been able to go out and kind of dispel some of the myths we were talking about and some of that misinformation that we see on social media and people's confusion about what it is they should be doing to be safe and who is at risk. And I think when we think about, how vast a network can be, ours covers almost the entire state of New Jersey. You have a lot of different demographic groups, and you have to really make sure that you're reaching everyone, and that you're in the terms of the education, that you're keeping it very simple, so that it isn't overwhelming and it isn't. A pandemic is a scary thing. When you hear the word pandemic, it's a scary thing. So I think we have to, with confidence, move forward. Giving education that is simple and concrete and something that people can do and understand to protect themselves and also, of course, to protect their loved ones.
Excellent points, Dr. Harker. Thank you. And finally, Kiana, would you like to add to that as well?
Sure. I think it's also important to address the economic disparities in healthcare. Altogether when it comes to talking about bridging that gap in the trust with our community. Though that's on a legislative level, we can still have those conversations locally with our communities. It is, what we found here in COVID, which we all knew, and you read about it, the African Americans have the highest rate in cardiovascular disease and other comorbidities that have happened. But what we saw here with COVID-19 is that we weren't the ones just in statistics having it on paper, but truly in acquiring a virus of this magnitude had very high risk and poor outcome for the African American community. And that was probably largely due to a lot of the disparities that happen in those communities. Not having access to their primary care physicians, many walking around not knowing that they had some of these comorbidities, high blood pressure, diabetes, and any of those things. So when they acquired COVID and ended up with having those severity of symptoms, they weren't, one, aware that they were possibly even that sick. And second, when they finally found out, it was almost too late. And so it all starts with educating that community and being able to come in and having that conversation and really trying to find a solution to those disparities in healthcare right now for that community altogether. And with that, those conversations being said, changes being made can also increase the trust in the communities in which we live in.
Right, absolutely. It really is, Kiana, to your point, a public health disparity, and communication and education all go hand in hand. So I really think that it really helps us segue to our next question, which is, how do we, establish that confidence in education and that confidence in the patient feeling comfortable? How do we reimagine our industry to ensure that all clients have trust in our entity? Dr. Johnson.
So that's a great question too, and I think expanding on what we were just talking about with Kiana too, and this health disparities, that establishing trust in our educational institution. I believe here at Chamberlain we've done a great job, and are again that real-time communication, having open discussions, a platform for listening and sharing. And Chamberlain has also moved forward with initiative of setting forth a set of social justice commitments. And these are really guided by two principles. And the one that we're talking about consistently today is education, and then also advocacy. And so that's really, it's not a one-time message, a one-time thing, but it's becoming a way of who we are. And so it's creating a university, it's creating a culture that is, through creating a culture that is inclusive through education and through advocacy. So I think those are the two things we're doing here.
Fantastic. Who else would like to speak on that? Dr. Harker?
Sure. We saw, as we were looking at this group of new graduates here in New Jersey, the governor asked that we work to graduate medical students and nursing students early, which did occur. But what we were keenly aware of was that these nursing students had done simulated clinicals. They had not necessarily been in a COVID-19 environment completing clinical. Most of the programs took the students to simulation laboratories, and we certainly wanted to hire these highly skilled and qualified nurses, but we felt we needed to address that lack or that change in clinical performance at the end of their final semester. So we, because we could hire in New Jersey here graduate nurses, GN nurses who had not yet passed their NCLEX, and have them work with an emergency license, we actually structured a faculty mentor program within our organization on each of our campuses, where graduate nurses were paired with a faculty member, 1 to 4, 1 to 5, and they worked for their regular 3 12-hour shifts, but they were with that faculty member. They were on dedicated education units on the campuses where there were master's prepared nurses who had their degrees in nursing education. And they worked alongside nursing educators too, to kind of foster that first 4 weeks of return to not only their first job, their first real licensed practice, but also to allow them the opportunity to regain some of the footing they might have gotten in that last semester. We were so happy that Chamberlain created the registered nurse NCLEX prep, because we did use that as our NCLEX support for all of those GN students. We want them to pass their boards. They want to pass their boards. So that was a wonderful resource that we put to use. And we're finding that although they were afraid, and those fears are valid, what we built into it in terms of communication, education, demonstration, all of the things that go with building confidence before you're in the practice setting, really served them well. And for many of them, their 4 weeks is complete. They're on regular orientation, and many of them have passed their NCLEX at this point in our license. So I think when we talk about establishing trust, we have to be flexible and we have to be willing to change. We had a structure in place, but that structure would not fit this particular change, this particular scenario. So it really asked every single educator, units who were already overwhelmed, we really needed to ask them to step up and to do more. But the underlying knowledge was that we would have, if there was another surge of patients coming forward, we would have a better qualified workforce to address their needs. So I think that was just, a wonderful way to welcome them back to the profession.
That is really, really fantastic that you were able to implement that there. And we're really proud to be able to partner with your organization to be able to provide those resources, as well as seeing, the impact of how that's going to reestablish trust both in, with these providers as well as our future patients that we serve in the area. Fiona, did you have anything you'd like to add to that?
Sure. Actually, I'm delighted that, here at Chamberlain, we've been able to do those very things as well in establishing trust amongst our colleagues in our organization, as there have been several things that have come down our pipeline in regards to having those conversations about your social, racial injustices, and having our CEO, Lisa Wardell, send out those communication pieces weekly, our president, Karen Cox, speaking onto these things. I mean, it has been phenomenal. This team having those conversations with an international team who actually is going to go out and have these conversations further, or have a further understanding of the things that are happening in our communities in the world right now, because we're the ones that are making those phone calls with your CNOs. We're the ones having those conversations with your hospital leaders, your nurse educators. And so having some familiarity with that and being able to have the conversations amongst ourselves, being broadened in regards to maybe various topics people may not be aware of, just because maybe they just haven't been discussed before, witnessed before. But it's great that we have such a diverse group that we're able to have the conversations and be able to go out and be able to have these important conversations with not just our colleagues, but with our partners in our local hospitals and throughout the various states all over. So I just thought that, Chamberlain has done a tremendous job. And I'm not saying this just because I work there, but truly, out of all the organizations, we don't have to say it, but, I've worked at various organizations across over the past few years. And, even though we're in an era where this topic is so important, this was the first time I can say that I've witnessed an organization who really just picked the torch up and ran with it, to really approach it head on, to make sure that a platform was provided to have the important discussions and or solutions provided for this, the support that came behind it. Even if there isn't a right now solution, the importance of just having the conversations to hear different perspectives with your colleagues and your various friends that you may not have thought of before, because then it gives light to different conversations to have with those different organizations. And I think it's an all-around win-win for all of us.
Absolutely, Kiana, I couldn't agree with you more. And I have to say, it has been such a fantastic experience seeing all of this happen real time. As a colleague of yours, it's really been just an eye-opening and educational highlight of my career personally and professionally. So it's definitely been something. I'm proud to say that this has impacted a lot of people. And it really does speak to our next question, which is what healthcare education is doing to fill those gaps that exist between practice and reality. And I know that a lot of us have talked about, a lot of you have talked about in your answers so far, some of the examples of filling those gaps. Dr. Harker, you just spoke to the graduate nurse experience and how you've been, using those dedicated education units. And, Dr. Johnson, I know you have some pretty innovative things going on with the online BSN at Chamberlain. Would you like to talk a little bit about that?
Yes, I would. I think this is a perfect opportunity to lead into that. But I did want to say, through these examples that we have, we're highlighting again that communication, that support, and that collaboration among the academic institutions and healthcare in the practice setting, which is so important as we see right now in real time, supporting some of those gaps that we know exist. But again, we need a longer term solution. So the timing actually is impeccable for us here at Chamberlain. And over the past few years, we have been developing and intentionally designing a pre-licensure BSN program to be offered online. The initial impetus for this was the changes that we know are happening with higher education, the availability of academic technologies, and then also the shift in the healthcare setting, as we talked about today. But surely the pandemic has accelerated the need for a program like this. And so again, not a reaction to the pandemic, but again, a thoughtful solution that we knew were going to be based on future trends, which happen to be just so timely now due to the pandemic. So as we know, there are many universities and colleges and higher education that are shifting from a ground to an fully online, or in some cases hybrid models, but understanding the need for us to be more flexible in the way that we deliver our education. And so the BSN online option that we have in Chamberlain was built on essentially 3 pillars. We're using online platform that uses academic technologies to enhance the student learning experience. And this does include things such as an adaptive learning platform for their theory and didactic, and actually virtual simulation to replace some of those clinical hours that are required in a healthcare setting. And then also we have in-person orientation and skills practice and the on-site clinical practice. But one of the ways that we envisioned this program was actually partnering with healthcare systems to understand what those gaps were and the challenges that they were having when they see a newly prepared nurse, a new graduate nurse. And so Dr. Harker just explained to us some of those things that they are seeing, one with the accelerated graduation of our nurses that may not have been prepared as we thought they should have been for practice. But this has been a long-standing problem that we've had. And so actually using this innovative approach of using virtual clinicals as simulation, and then there's actual dedicated episodic clinical immersions that are happening in our clinical spots with our clinical partners. But using this actually helps prepare students better for clinical practice when we're using virtual simulation, as we can control the type of experiences that the students are having. We can simulate things such as crisis care for a student that they may not have in a traditional clinical model. And also with our clinical immersions that are episodic and occurring in consecutive days rather than throughout an entire semester or term, as many traditional clinicals are given, we also are decreasing the total number of hours at clinical facilities and easing the nurse workload too. And as we know too, one of the things that we haven't talked about yet that was again highlighted by the pandemic is the stress our nurses are feeling. And the burdens they are having, and the overload that they have. And so bringing students onto the clinical, we know, is an additional sometimes burden to the workload, or additional workload to that nurse. We know that many love to be educators in that setting and provide those opportunities to nursing students, but again, it's another responsibility. And so being sensitive also to our nurses and wanting not to overburden them with this workload, we've reimagined what these clinicals can look like in the BSN online program.
Yeah, the academic practice partnership is definitely a thing of the future, and I think it's here to stay. That's safe to say, right? It's exciting. It's really exciting to see that. And you're right, Dr. Johnson. Perfect timing, but not forced. It was planned and long term. I knew about it coming for quite some time, and it was really interesting to see how the timing was rather impeccable as far as being able to launch this right during this time. So, anybody else have any thoughts or comments that they'd like to add to filling those gaps that exist between practice and reality?
I think Dr. Johnson covered it.
Great. Well, we can certainly move.
I've got a delay, but I do want to add something, and maybe Dr. Harker too would respond to this as well. But I had mentioned about our nurses and the stress that our nurses have. And I want to kind of go back to the trust issue that we've talked about from the beginning. And we know that nurses are the most trusted profession in the US for, I think, almost over the past 20 years. So we know that there is a lot of trust in our nurses and that nurses want to care for patients in the safest manner. And that the compassion of nurses has also been highlighted during this pandemic. But then also, like I was speaking to, that stress, and we see compassion fatigue and mental stress. And then now there's more of a focus, and I think in the healthcare setting as well, this focus on how do we protect our nurses? How do we minimize the impact of traumatic stress on our nurses and of compassion fatigue, which can lead to the burnout and people actually leaving our profession. So one of the things when we think about reimagining nursing education due to the current pandemic and due to our current healthcare climate and knowing what the future holds for our nurses, it's important to equip our nursing students with the skills that they need to enable to protect their mental health. And there's an intentional focus in our curriculum, not only on mindfulness, there's a whole course dedicated to that, but it becomes a theme throughout the program for students and is socialized as part of nursing practice, part of the nursing role. And there's also this intentional focus on balancing self-care and care for patients. So I do know too, during the pandemic, many healthcare institutions started wellness programs or re-emphasized wellness programs for their nurses, having counseling available, having group support for them, doing positive things within their environment to help protect and support mental and emotional capacity of nurses. So I think that as preparing our nurses in the educational role is now going to help them be more resilient in that role of nurse and socializing this as part of the nurse's role. So Dr. Harker, I don't know if in your situation, in your healthcare settings, you've seen this with your nurses and that there's things that have been started because of the pandemic or were there because of the pandemic and now have been refined or highlighted or have moved forward as part of the future practices there in the healthcare setting.
Yes, thank you so much, Dr. Johnson. We actually did have the Integrative Health and Medicine program had developed resources in mindfulness and meditation and self-care. And we had those available, but I think what happened is when the pandemic started to really affect the workforce in a very short period of time, we have a vice president of wellness who is a physician who was able to create and structure a whole set of resources. And what was really nice about it is that it was really done around the clock, all shifts, every day of the week. So any employee, no matter what time of day, they were working or what their availability is, because, everybody was home with kids too. You could tune in at like 8 or 10 different times a day and do a yoga meditation. Or if you didn't like that, you could tune in and do a guided visual imagery. Or we had, believe it or not, we had remote virtual Reiki, energy work. So along with visiting, we did a program about visiting our critical care areas. So someone from integrative medicine, someone from our nutritionist, as well as pastoral care, they were all going into those areas and they were all looking to help support the team, whether it was in, nutrition and are you eating and are you eating well, sleep questions, issues, of maybe having some alteration in sleep during that period. So, and counseling and support services with a 24-hour, 7-day-a-week call-in line that was able to be accessed by all team members, and you could get support right on that phone line. But then if you needed additional resources, there were referrals for those as well. So I think it's wonderful that you're actually laying the foundation with your students so that when they come to us and they begin to work in whether it's our GN program for as long as that lasts, until the state of emergency is lifted, or our residency program, it won't be unfamiliar to them. They'll already have had an introduction to it. which I think will make them stronger and help them to understand that it is self-care is not selfish, and that burnout is real, and that we need to, we cannot give from an empty cup. We have to fill our own cup before we can give more. So I'm thrilled to hear about that. I think that's amazing. Thank you.
Fantastic. Go ahead.
I just wanted to follow up on Dr. Johnson speaking on the burnout for the nurses, and it made me remember a conversation I've been having with my colleagues about that. And one of the things that I do know, especially for the new nurses that were just starting work during this COVID-19 season, without a pandemic, it's already difficult in coming onto a new unit and trying to balance having to learn the job, like she said, from practice to reality of how you really have to juggle and all of the things that are necessary for you to learn on that unit. And then have it be compounded with COVID-19, which would increase the stress level for even your mature nurses, your tenured nurses who've been there for quite a while, who were stressed about the increase of patient volume that typically happens, but that there, instead of a bell curve, it was just a straight line up, and it just seemed like there was never any increase or never any downtime in it. So truly, a nurse could burn out earlier. But one of the things that I learned they were doing in some of the units was actually taking those new nurses and having appreciation days, making sure that they just weren't left in the shadows to suffer alone. That they truly were still pushing them out front, letting those nurses who had been there for some years, letting them know that they were still available to help, bringing in, extra goodies and stuff, or, putting their names up on walls, or creating like week, a new nurse of the week or new nurse, just encouraging them so that they would not burn out on those units, and letting them know that they are still, they still provide some value and coming onto those units every day, and that it is not gone unnoticed. So you guys in speaking made me reflect on those things. So I do know that was happening on some of the units, and I thought it was a great thing.
That's fantastic, Kiana. Thank you so much for sharing that. And, we all know that residency programs have already been such a strong, hallmark of support to the new nurses as well. And I know, Dr. Harker, you have a lot of experience with that, having launched that in your own health system. It's definitely been taken to the next level. So I think that, this is really has been such a great conversation, and we've shared so many great things about how we've been able to fill those gaps. And it's really the next steps for that rebuilding of the trust with our relationships, specifically between the educators and the workforce, and then the providers and the patients. That is my final question for you all, to talk about how do we rebuild that trust, and how do we really set this stage for what's next. We all talk about the new normal and the future normal and all those things. We have somewhere to go, and we are at a very opportune moment. There's a lot of opportunity here, I think, in healthcare and healthcare education, where we can really take the torch, like we all talked about, and utilize what we've learned from this experience and move forward with it. So I'd love to hear your final closing thoughts, and I'll go from Dr. Johnson to Dr. Harper to Kiana from there.
Great. Okay, thank you. So as we have discussed throughout this time, that the pandemic has highlighted the importance of collaborative work between disciplines and across organizations, specifically the importance of the education and practice partnerships. Education supports research and scholarship to address the pandemic, diversity, inclusion, and to help provide solutions to changes in practice that we know are needed as we move forward. These partnerships are key in establishing relationships that are built through mutual trust and communication and shared respect between the academic institutes and the healthcare facilities. So listening to the needs of our partners and working together to create solutions to address those needs is of high importance. And again, this is what is modeled on our new BSN online program, an academic practice partnership, which is a shared commitment to decrease the gap between nursing education and nursing practice, thus improving the quality of nursing education, advancing practice of nursing and healthcare delivery, and enhancing the health of our community. And all of those will go a long way in rebuilding and supporting trust. Trust among the nurses, trust among our patients, and then trust in nursing education as well.
Fantastic. Thank you so much, Dr. Johnson. Dr. Harker, last comments, final comments?
Yes, I think what's most important to me is that we continue engagement at all levels of our organizations, and that we are constantly looking to the clinical bedside, the person closest to the point of care with the patient, how to change practice and how to structure our patient-centered care in the work environment as it changes. They are really the best decision makers and the people we should trust with those decisions as often as we can.
Absolutely. Absolutely. Definitely. Thank you so much. And Kiana?
I must agree with both my colleagues here. Continue to have those educational evidence-based practice conversations. I do know it's so hard because there's so much on social media. There's so much being thrown at you, and then you have to hear your friends and family opinions as well. But it's so important and it's so vital to listen to those who are in those professions, to listen to those who have educated themselves and have done the research on the very thing in which we're standing in right now. I would not go to a plumber to fix the electric in my home. And it is the same thing with this COVID-19 pandemic that we are in. It is very vital that we listen to those who do specialize in this very thing. It's for the safety of our communities, so that we too can be educated to go out and educate our friends, families, and the patients and others people that we come in contact with that we serve.
Absolutely. It's all about trust, and it's definitely something that I think, like I said before, we really do have an opportunity to put that trust back and rebuild it in a really solid manner based on all of these things that we've discussed here today. I am so grateful that we've had the discussion. That's where we start, having this open dialogue, having this communication, and really taking advantage of the relationships that we all have with one another and our colleagues. So Dr. Johnson, Dr. Harker, and Kiana, thank you so much for taking the time to be with us today on this panel. It has been an honor to talk with you and discuss this, and to our audience, thank you so much for joining us today. Join us next week. We have another fantastic mastermind session ready for you. We are going to be talking about the Daisy Foundation Spotlight, and that'll be Wednesday, July 22nd at 1 o'clock Central Time. That'll be moderated by Chamberlain University's Regional Workforce Solutions Manager, Peggy Guillory. There's no need to RSVP. You can just follow us on our social media live streams, and we hope to see you there. Thanks so much again, and have a great day, everyone.